The Ministry of Health is expected to draft a national health laboratory policy as soon as practicable to address a long-standing impasse between the Association of Medical Laboratory Scientists and the Ghana Medical Association. The roadmap outlined by Parliament's Select Committee on Health is to address the conflict between laboratory physicians and medical laboratory sciences, which has affected health service delivery over the past years. The impasse has already led to some labor unrest within the health sector, which may further be aggravated if not tackled effectively. Now we have Joseph Opoku-Gakpo. He has a copy of an internal memo and draft roadmap by the Ministry of Health. Let's start with a memo. What are the details, Joseph? Right, Joseph, you'd have to unmute so we can hear you out.
Right. To run through them.
All right.
Israel, if you can hear me, from the internal memo that we've laid hands on, the indication is that the meeting chaired by the chairman of the health committee, Dr. Ayuefriye, came up with a number of plans on the way forward. First being that the Ministry of Health will be reviewing the draft national health policy as soon as practicable. The Health Facility Regulatory Authority will be defining the workspace and personnel for various lab practices. The Ministry of Health would also be laying in Parliament a legislative instrument that would eventually back the Act 857, which governs the work of various health institutions. Not just that, there are a number of other items that are planned as far as the way forward is concerned. The Komfanochi Teaching Hospital and all the residents there are to be given access to the training facilities and as well receive the necessary support to do their work. The Ministry of Health will be restoring the two CAF laboratory physicians to their work environment in the Laboratory Services Directorate. And to touch briefly on the final 3 points as far as the agreements are concerned, the Ministry of Health's HR Directorate will be coordinating the creation of a career path and professional growth process for the medical laboratory scientists. And the indication again is that the Ministry of Health will be working with stakeholders to establish a College of Medical Laboratory Scientists. So that's what the roadmap looks like going forward, following the engagement with the Health Committee of Parliament over the last few weeks.
All right, so help us out again. What will be the next steps immediately from this update we have on work of the Parliamentary Committee? All right, we appear to have lost Joseph Opoku-Gakpo there, but let's move on to Dr. Abudu Rahman. He's the president of the Ghana Association of Medical Laboratory Scientists. Thank you very much, Doc. Now, what did the last meeting agree on?
Good evening to your listeners and viewers. Well, the last meeting was basically to give us an idea what the ministry has at stake for the peaceful resolution of the impasse between us and our colleagues.
All right, and what are the outstanding issues as far as the roadmap is concerned? In fact, do you have a copy of this roadmap, and is that does it meet your expectations?
Yes, we have a copy of the roadmap. In fact, immediately after the presentation, the chairman of the Select Committee on Health did a short had a copy, and then we have been given up to Wednesday to file a response. And for us, well, they presented issues and things that they believe we want to hear and we want to be happy about it. And truly, well, they have some of the issues that they had presented which look exciting. For us, it is not about what is presented, but about when and how it's going to be implemented. That is our issue at the moment, because we've heard so much from the ministry. We've heard a lot of good news from them, which is only to buy time and then hope that the action of the laboratory scientists will come down.
All right, please hold on for me. I have also on phone Dr. Justice Yangsing, is the General Secretary of the Ghana Medical Association. Thank you very much, Dr. Justice Yangsing. Now, the Parliamentary Committee, after several deliberations, is giving an interim directive to both sides. Please walk us through them.
Well, Ija, I think we need to clarify what is happening.
All right.
My brother tried his best. I think he sort of straightened what was put out by
Joseph.
Yeah, by Joseph. But I think what essentially happened at our last meeting was that the Ministry of Health was to present its formal position as to how they were going to resolve the issues at stake.
All right.
And within it, they came up with what we can describe as their roadmap that they were going to work with to ensure that come November, at least that was the timelines given per their presentation, a lot of these issues will be resolved. And at that point, the ministry and the Parliamentary Select Committee were unanimous on one thing, and that was that the laboratory physicians and all other cadre of medical personnel in training, as far as lab issues are concerned, were to return back to post such that their primary occupation in terms of work will go on, as well as training. The principle was that they wanted to preserve the status quo whilst the issues are being addressed. So basically, the directive from the ministry and the health committee was that the doctors who had been pushed out of the laboratory should go back to the laboratory and start work. Those who are in training and are not also being given access to the laboratory are supposed to go back and have access to the facilities for their training. The other bit was that all parties were supposed to give some written responses, if any, to the roadmap as contained in the briefing by the Ministry of Health. So basically, this is what transpired. Then there were some issues around the development of the National Laboratory Policy, which some work had actually started as at the time we had the meeting. So all the bits that Joseph presented were right, except to say that those were the roadmap as developed by the ministry, which the stakeholders are supposed to put in their written submissions to either enrich it or whatever it is, at least make their input by way of some written submission to the committee.
All right.
The committee would then continue with the processes together with the ministry to ensure that all the bits are done. But like I said, the key directive was that all those who have been pushed out of the lab should go back to work whilst we go through the processes pending potentially a resolution somewhere in November 2021.
All right, Dr. Jackson, two things I'm interested in. First of all, have you made your inputs as far as the roadmap is concerned? I'm talking about the Ghana Medical Association. And then, do you know if the status quo that was talked about has been restored?
Well, per the directive, it was just last Friday. So we are looking at today, tomorrow, by Wednesday, we'll have a very fair idea if the directive as given by the ministry and the select committee has actually been heeded to by all parties. Interestingly, the teaching hospitals where most of these problems are occurring also had all their CEOs present. The Ghana College of Physicians and Surgeons also had their rector present. So I guess that today is just day one. All the necessary activities and, basic communications may have to take place before we can really judge that indeed they have been given unfettered access to the laboratories to continue their work and to train. And the caveat is that this particular directive is for the period now till the completion of the various processes as outlined by the ministry that all of us are going to give input. Once those processes are completed, I guess the way forward will be very clear to all parties.
All right. Thank you very much, Dr. Justice Yang Sing of the Ghana Medical Association. Fortunately, I have still on the line, Dr. Abu Abudu Rahmani. He's the president of the Ghana Association of Medical Laboratory Sciences. So, Dr. Rahmani, you heard Dr. Justice Yang Sing, and from what he's saying, the one thing that's outstanding is that you're supposed to allow the doctors to take their places in the laboratories. Is that something that you're willing to allow to happen?
Well, you know, I knew once you brought him online, that would be his first trademark. But let's say for a fact that even at the meeting, we had disagreement over it. Because if you say we should return to the status quo in the first place, where the people in the lab in the first place before they were booted out, before the strike action began, were they in the lab? That's the question we ask ourselves. If they were not in the lab, then they should stay where they are before the strike action began.
But they had been appointed, Dr. Rahmani. They had appointments. They have appointment.
They didn't. There's no appointment. What's their job description? If they are coming into the lab, you see, there's one thing we need to realize that when they said they should provide them with the technical support. They should be provided with technical support. Who are they going to go to for that technical support? Who are going to provide that technical support? I believe that our understanding was the fact that the ministry gave a roadmap. We had issues with the roadmap, and that is the reason why we are going to issue our part to the Parliamentary Select Committee on Health.
All right.
So it doesn't lie with anyone to say that, we are looking at today or tomorrow. You understand? It doesn't lie in the mouth of anyone to just say we are looking at today or tomorrow. What they need to understand is that you cannot push your way onto some people. It is dialogue that will make us understand each other. So if they want to come into the lab, they should have cool. We'll have the time and then we'll have an understanding. We'll talk about it and then we'll resolve it. But for now, as someone will say, they should just have cool.
So as far as you're concerned, you didn't actually agree to the roadmap?
Actually, no. The roadmap, we have issue with the roadmap. You know, I was telling you that they gave issues that we wanted to understand. But be it as it may, as we always...
All right. Okay, we're losing...
what they said, we know what to do.
All right, thank you very much, Dr. Rahmani. Dr. Justice Yang Sing actually is still on the line. Dr. Justice Yang Sing, quickly, I'd want to get your reaction to that. He says that they didn't quite agree to the roadmap, and as far as the status quo that you're talking about is concerned, it doesn't mean that the doctors are supposed to be in the lab.
Well, it's unfortunate that my brother wants to take this approach, but all the same, that is what he is saying. At the third meeting, the Parliamentary Select Committee, working through the legal person on the committee, explained in detail to them what status quo ante actually means.
But he says they don't agree.
It is what existed before the impasse. And laboratory physicians have always been in the laboratory. They actually train most of them, including Dr. Rahman himself. The laboratory physicians actually set up their school in Kolebu, for example. So if today he is saying that there were no laboratory physicians in the laboratory before the impasse, how come, in quote, this impasse has been there since 2016? Because the Conformer bit is just something that happened a couple of weeks ago.
All right.
So clearly, I think that maybe they are going against or they are serving an intention to go against what the Parliamentary Select Committee and the ministry directed at the last meeting. That bit was a directive. It was not just contained in the roadmap. Right. It was singled out, discussed, and the directive given them. In fact, the chairman of the committee did make it clear that if anybody decides not to abide by their interim directive, then it may get to a point you cannot even come to them to seek redress. because you need to show them that respect.
All right.
Because this is supposed to be a transitional or a temporary arrangement between now and say November, the deadline given. And it is so clear that they should have access to training facilities and what have you. How can you say that people who are going to be trained for the state owns the hospital, the state owns the equipment in the laboratories, and somebody has to be trained by the state through an institution that has been set up by law, by the state, and you say you won't give them access, as if the laboratories belong to you? It is unfortunate.
Okay.
But be that it may, we'll live to see.
All right.
I just wanted to correct my brother that when I said that today, tomorrow, days to come, we're going to observe, it was in relation to the question you asked me as to whether we can confirm that our people have been able to access the laboratory. And that's what I explained, that today being the first day, it's early days yet. We'll need a couple more days to be sure whether they have indeed been given unfettered access or otherwise.
All right.
So I just wanted to get that clarity to him.
Thank you very much. Dr. Jasix Yansing is the General Secretary of the Ghana Medical Association.